Hello, everybody. This is Gary. Today is Tuesday, January 31st, 2023. It is 3:02 p.m. Eastern Standard Time in the United States and Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today I'm doing pretty good. My anxiety levels are pretty low. My paranoia is not that bad. My depression is not that severe. My auditory hallucinations are at a bare minimum. I will be seeing my therapist this Thursday. Today's Tuesday, and I will be seeing my psychiatrist on Friday. I don't suspect we'll make any changes to my medications. I'm sticking to my daily schedule every day. I already went out for a walk today. I also went to the pharmacy and picked up some of my prescriptions, including my Cymbalta, which I take for physical pain, even though it's an antidepressant. I also picked up my Zofran, which I use for nausea, and I picked up another medication. I can't remember what it was. It was Zyprexa, which I'm allowed to take 5 milligrams twice a day for paranoia and auditory hallucinations. But my main drug is still Seroquel. I'm on 600 milligrams of Seroquel every night at bedtime. I do meditation 3 times a day. I do work on my computer every day. To make extra money, I do consumer surveys. Some of the surveys that I use are Clear Voice surveys, Survey Junkie, and Nielsen surveys, and there's a few others. Panda Research. They're not paying me to say those things. Those are just some of the survey sites I use to keep busy and to make extra money. I still, of course, have the diagnosis of pulmonary fibrosis, which means scar tissue is developing in my lungs, which makes it more difficult to breathe when I exercise or go for a walk. But I still do my daily walks, even though it's somewhat uncomfortable, partly because it's freezing cold outside. It's the middle of winter here in Rochester, New York. Rochester, New York is in the upper northern part of the United States, near the East Coast. So it gets pretty cold during the winter. I was outside today and it was pretty cold to be walking around, but I try to walk around every day because I am overweight and I do need the exercise, and I'm trying to eat less and lose weight because it's already difficult to breathe because of the pulmonary fibrosis, and being overweight also makes it more difficult to breathe when I'm walking around. Part of my weight gain can be blamed on the Seroquel. Seroquel has a tendency to shut down that part of your brain that tells you when you're full, when you're eating, so you tend to eat more. And that's very common among people who are on psychiatric drugs, especially antipsychotics. They tend to gain a lot of weight. And I'm trying to lose the weight that I've gained over the past few years. I'm about 30 pounds overweight. Part of it is because of the Seroquel, but part of it's because I haven't been exercising enough and I'm overeating, which I do have some control over, regardless of whether or not I'm on Seroquel. But I'm also pre-diabetic and I have high cholesterol. I did see my primary nurse practitioner last week. She added a blood pressure medication to my medications because my heart rate was very rapid. It was about 120 beats per minute, and my blood pressure was high. It was like 177 over 99 or something like that. So I'm taking 3 blood pressure medications now, and the medications that she added, I don't remember the name of it, but it's supposed to help reduce my blood pressure as well as lower the speed of my heart and my pulse rate, because it's consistently high whenever the doctors or the nurses measure my blood pressure and my pulse. My oxygen level was 92%, which is pretty good. I was thinking about buying an oxygen meter, which is the meter you put on your fingertip, and it tells you how much oxygen is in your blood. And if it gets below like 90, that's not a good sign. But if it's like 92, 93, that's all right. It's even better if it's like 96 or 97%. Um, they're not expensive. I was thinking about buying one just so I can monitor my own oxygen levels at home. I've already bought a couple months ago my own blood pressure machine and cuff. My blood pressure is consistently high when I measure it, when my doctor measures it, when the nurse at the psychiatric office measures it. So that's why they added an extra blood pressure medication. And also because the speed of my heart was pretty high. Um, it's somewhat difficult to manage all these different medications. I'm taking medications for acid reflux. I'm taking medications for high blood pressure, rapid heartbeat. Um, I'm taking, of course, psychiatric medications, Klonopin for anxieties, Zyprexa for psychosis, Seroquel for mood stabilization and antipsychotic. Um, I'm on lots of different medications. I'm on laxatives because my psychiatric medications tend to cause constipation. I have had to go to the emergency room before because of constipation, and they would give me an enema, um, and I'd rather not do that, so I take laxatives on a daily basis: Miralax, Senecot, and one other one I can't remember what it is. I think it's Colace, the stool softener. Um, but yeah, I have to coordinate all these different medications with my doctors, and I'll be seeing the pulmonary specialist on March 28th. They'll test the strength of my lungs, test the strength of my ability to breathe, and see how bad the scar tissue is in my lungs. The CAT scan that showed that I have scar tissue in my lungs showed that it was in the bottom of my lungs, and we're not sure what caused it. It's scar tissue in the lungs like that is usually caused by some sort of chemical irritation, and the only thing I can think of is that I overused Clorox to clean my apartment, and maybe the fumes damaged my lungs over time, or I use a lot of bug spray, or have used a lot of bug spray in the past, and accidentally breathed it in. Those are the only two chemicals I can think of that would irritate my lungs to the point of having permanent scar tissue. But that's all for now. I'm doing pretty good today. I'm sticking to my daily schedule. My psychiatric symptoms are not that intense today. I am having some problems with insomnia, but that comes and goes. But that's all for now. Like, comment, share, subscribe.